It is Health Diary. Thank you for making time. My name is Gladys Gachanja and we're coming to you from Parkin by Radisson here in Westlands. Now, the World Health Organization records that obstetric fistula affects close to 100,000 women worldwide each year. Here in Kenya, 2 women get obstetric fistula per 100 births. Now, these women cannot live a normal life because they not only get isolated, but in some cases even disowned because of the condition they live with. So today we shed light on obstetric fistula and also understand what more we can do to support those who live this reality. But before we get to it, here now is a fact of the matter. A fistula is a hole that forms between 2 organs when the blood supply to a tissue is cut off, causing it to disintegrate. Fistulas can occur in various parts of the body, but the most common in women is the obstetric fistula. This is a medical condition in which a hole develops in the birth canal as a result of prolonged or obstructed labor. It can occur between the vagina and rectum, ureter, or bladder, resulting in incontinence of urine or feces. With proper medical care, fistulas are both preventable and treatable.
My name is Caroline Wagakiwairia. I'm 28 years old. I'm a mother of 2, a boy and a girl. And I'm a fistula survivor. I heard of this fistula problem when I was giving birth to my firstborn girl. That was 2014, where I had a tear when I was delivering. I was treated and the tear was taken care of. So on my second born, I also went to hospital as I was delivering, the same case about the tear. So they took me again to surgery. That was 2017. But in between 2014 and 2017, I was having some back pain. I could not hold some urine or some stool. And also my self-esteem was down because I could not be able to tell even somebody what was the problem. So on 2017, as I was giving birth also, I went for the surgery again. I was told I was taken care of. But after for that long, I realized that something is wrong with me. So I went for some checkup from different hospitals. They were treating me. And sometimes I was booked for a gynecologist, which is expensive. So I was using my money to take care of those needs. When I heard about the fistula camp at Mama Rusi, I just tried that I'm gonna try it. So they took me for surgery and they took care of everything, my medication, the surgery. I thank God that right now I can be able to hold my urine for at least a long time, and my self-esteem, it's back. By there, I thank my parents and my brothers and sisters. They have been there for me, they have stood there for me, and they have helped me through this journey. I would urge every woman out there who is listening to me to come out. If you have that problem, just go and be checked up. And if you hear for any camp that is there, that is all over, just try your best and go there, because those camps do help people, because it helped me a lot.
So let's get to understand obstetric fistula, and to help us do so, we have Sharon Korir, who is a fistula ambassador and also a survivor of obstetric fistula, and also joined by Dr. Weston Kisser, who is a fistula surgeon. Thank you for making time. I'll start off with you, Daktari. Let's define what a fistula is before we get to the details of the different kinds.
A fistula is an abnormal communication or connection between the bladder of a woman and her birth canal and also between the rectum and her birth canal. And this results from prolonged labor leading to injury of the tissues that we find between the urinary bladder and or the rectum to the birth canal.
Okay, you have mentioned perhaps the most common ones. Do we have any other fistulas that can affect the body?
Fistulas can happen in any other part of the body. The common ones we are talking about is the obstetric fistula. However, we have other regions of the body that also can get fistula.
And you talked about prolonged labor being the greatest cause of obstetric fistulas, yes?
That's correct.
However, some women many women labor for long hours, but they do not have this condition. Why the discrepancy?
It has to do with the disproportion that happens between the baby and the maternal passage, so to speak, and the powers that the mother is pushing the baby through the birth canal. For example, if a woman has no strong contractions, she is going to have a delayed or prolonged labor. So if you improved, for example, the contractions or the power, then the woman will probably deliver within the time expected. And so sometimes the definition has to be limited to this woman who has hopefully an adequate pelvis or passage and also an appropriate size of the baby for one to get obstructed or prolonged labor.
All right, so this is something that is sort of similar to what happened to you, Sharon. What exactly happened for you to be diagnosed with a fistula?
At that time, I had just given birth to my baby, and the hospital. We had about 21 days in hospital because of a few complications. And when we got home, I realized, my body is not okay. I realized that there was an interchange of organs. I used to pass stool from my vagina, and at the same time, I'm wondering my urine is coming out from the rectum. There's more of an interchange of organs, and then at the same time, I couldn't hold. I couldn't be in a position to hold urine. I would, it would just pass out, and I had to use sanitary towels. Yeah, so I didn't even know what fistula is, so I was confused. I even thought I had lost it. Like, is this hospital? When you're in hospital for so long, you think you're going through depression, postnatal depression, and everything. I thought I was losing it. Then with time, I figured myself out, and at that time, I didn't even know who I would tell that I think I'm not holding urine. I think I'm smelling. I think I'm not fine. And after a couple of months, I told my sister-in-law. She's a nurse in Kenyatta, that this is what is happening, and she told me she suspects I have fistula. So at that time, those Kenyatta Hospital was running their camps, and those advertisements in the media. So I went to Kenyatta. I was, the diagnosis, screening. Then they found out that I had fistula.
So how long after you were discharged did you notice the difference?
I did notice I was not fine. But I think my son had issues with blood exchange,
Yes.
rhesus factor problems. So my mind was all on my baby because they had to do a blood exchange at that time. But again, I would still realize I'm not fine. I even told the nurse, and the nurse was like, maybe you need to do Kegels. Maybe you need to see. Maybe the nurse would always try and see how she can help you. But again, I thought my first baby and second baby, how come the experience is so different on how I am, and also the discharge that was out, that I had to keep using sanitary towels and all that, and this, of course, being smelly and different, completely different from the normal.
Okay, some of the reasons why women get delayed intervention is because they cannot even recognize the symptoms of obstetric fistula. So which are these, Dr.
So when injury has happened between the bladder and the birth canal, the woman leaks urine continuously through the abnormal communication to the vagina or the birth canal and outside. And also, if the injury has happened to the rectum, the stool will leak through the birth canal and also outside. Sometimes women have both. And if they are lucky, they have one.
So perhaps could we say the bleeding that happens after childbirth could throw off a mother or even a midwife or a nurse as to if this is actually a fistula or just a normal discharge after birth?
It's possible that you may not recognize quickly that there's something has happened. And this also causes delay in them seeking advice. And sometimes you are assured by the midwife or the people around you that this actually follows childbirth and it quickly clears out. So relax. And when in actual sense, you should be seeking care.
Okay, so for you, Sharon, when now you notice something was off, how are you dealing with what's happening now apart from wearing the pads?
I didn't want visitors to come so close to come visit the baby and me. I was traumatized. I was low in my life at that point. I was devastated, to be honest, because the change, anything changes, radical change, it really affects our lives. So you can imagine that point you have a small baby, you've been in hospital, then again your body is discharging, what you never ever thought of. You feel down, you even feel a point of feeling so, having low self-esteem. You really feel down in your life at that time. Then you have to, of course, now back again to hospital and back to screening, and the whole process begins again. Yeah,
we'll talk more about the stigma when we come back from the break. But before we take that break, Daktari, quickly, still back on the causes: abortions, cancer, inflammatory bowel diseases, and even sexual abuse have been some other conditions or circumstances listed to cause obstetric fistula. Which others?
Cancer on its own can cause fistula, and that we don't describe it as a obstetric. Okay, you could call it injuries that are caused because of cancer or because of radiation treatment for the for the cancer that leads to a fistula formation, which not necessarily related to labor. We call it non-obstetric fistulas. As such, and those can come from what you have just quickly described there. Surgery of other conditions, like, for example, removing the uterus, hysterectomy, like bowels, when you are operating on the intestines, then you can cause injury, and this will lead to a fistula formation. Diseases like measles, like diphtheria, and even sexually transmitted diseases like LGV can actually lead to fistula formation in the genital tract, but they are not necessarily obstetric.
Okay, and this is where we were mentioning that there are other fistulas apart from obstetric fistula. Well, we take a short break. At this point, when we come back, we understand the stigma that comes with living with this condition, and of course, the treatment plans that are out there to help along women living with this reality. We'll be right back. Welcome back to Health Diary. My name is Gladys Gachanja. Today we are understanding more about obstetric fistula, and to help us do so, we have Sharon Korir, who is a survivor and ambassador of the same, and of course we have Dr. Kisa, who is a fistula surgeon, helping us along with this conversation. And we talked about the stigma, the effects that come with living with this condition. Talk about some of those that you faced.
We live in a cultural-based society where the matters, fistula and all that can be regarded as maybe witchcraft, maybe it's a taboo. Like how could you, what is it that you did that is making you be the way you are? Yeah, so most women actually get this stigmatized, especially in the rural areas, because fistula is associated with the poor, and majority of the women who get fistula are poor. Yeah, so for my experience, for me, it was quite brief indeed, yes, but still, you could still feel like, you of course, you isolate yourself because you're in a season where you wouldn't want anybody to know that you were smelling or discharging any fecal matter. I wasn't even bold enough to tell my family at that time. None of my members of my family, my sisters and my dad and my close friends. I kept it quite very discreet. It was just matters about me and healing first, then I could be able to open up.
Okay, and you said it's mostly associated with the poor. Now, you came from a different cadre of society and you were facing fistula. When you share the fact that you've had fistula, what's the reaction?
They think, they think like, what? You know, how can you get proper health care? Were you in hospital? Yes. Among the best hospitals in this country, definitely Nairobi. How could you have gotten fistula? Okay, my story is that I got it through prolonged labor. My doctor was, he had induced me, left, but he came a bit too late. So by the time he was coming, I was too tired. Baby was tired. I was, the pressure pushed the baby completely, tore my lining all the way to the rectum. So there was a hole. That's 4th-degree tear. Yeah, it happens. Actually, it actually happens all over. It doesn't really mean that the poor and the rich and the middle class, no. I think it actually happens even all over the world, yes.
Once this has happened, they're likely going to, because of smell, because of making their clothes dirty, they cannot sit or join the family. They find themselves withdrawn. Then they undergo social depression. They undergo mental depression. So you find that the programs that we set to help these women are acute towards trying to quickly provide a solution to a woman who has developed a fistula or who is leaking urine or stool immediately after childbirth. And if we do that, then we substantially reduce the stigma.
Okay, and when we talk about the treatment, what was the treatment plan for you, Sharon?
Immediately I went to Dr. Kisa for screening in Kenyatta Hospital. I was recommended to Dr. Kisa, my surgeon, that's right here. And it was first the mental part. He had to take me through, like, this is what is happening. He actually drew up, did a diagram. This is what happened to your system, so that I can understand fully what is the process of healing. So he took a diagram, took me through exactly what it entails having a fistula. Then again, this is how we're going to do the corrective surgery. So surgery had to be done. Then now the healing process takes another 6 months. So of course a lot of antibiotics, a lot of painkillers, because it's really painful.
Okay, Dr. Kisa, apart from the surgery, do we have any other interventions?
Yeah, we have to look at it this way. We provide a holistic service, and in the holistic service, it starts with counseling, because mentally these women have undergone depression. After we have done the repair, there's a lot of nursing care that comes in. There is a lot of counseling that continues, and there is nutrition support to promote healing, and sometimes even not just to promote healing, but to even place after they have healed, or to take them home. So the social worker can play such a big role in trying to rehabilitate. The physiotherapists are not left out because many of these women are likely to develop what we call a foot drop, whereby there have been injury to the nerves in the birth canal, and they are not able to walk properly. So they have to be rehabilitated so that they are able to take care of themselves, so to speak.
Okay, Sharon, let's talk about the cost of treatment.
There are stakeholders with Fistula, yes, and Kenyatta Hospital, Blind Daughters Society of Africa, Fistula Foundation, they all come in to help women get free treatment. However, I actually did mine privately with Dr. Kisa, yeah. And Dr. Kisa, at that time I was financially down. I was just beginning my career, And then Dr. Kisa may say he's really passionate about what he does, because so much of the time I would tell him, you know what, sir, this is it. Things are bad. So what he would really come in and tell me, at the end of the day, we want to see women who are okay, who get their dignity back. His team in family healthcare in Hurlingham did a lot of counseling, a lot of support, even financially, even psychologically at that point in time, and I really got healing. And for now, it's for free in Kenyatta Hospital, in Machakos Level 5 Hospital, in Gynecare in Eldoret, because there are stakeholders that are involved who come in to partner to ensure that women are okay.
In public institutions, you can use NHIF to access that service for, I wouldn't say for free, because it will be paid by NHIF. Unfortunately for the private insurance companies, we have a challenge and many of them do not cover childbirth-related injuries. And so it's lumped as maternity, which usually carries very small amount. Interesting is that also that insurances don't deal with public institutions per se. There is no clear MOU in private insurances supporting these services in a public institution. So if a woman chooses to go into a public institution, they have to support themselves.
And Daktari, I remember back in 2018, the Ministry of Health was said to be working on a national framework on fistula management. Has this become a reality, and how is it helping, create or avail the interventions that women need in this country?
That's true, that the fistula framework was completed and launched somewhere in West Pokot. And the challenges that we meet, for example, have been how to implement it. And when you come to implementation, you face certain strides that you didn't anticipate, especially financial and not so much of personnel, and also because it was meant to help the Minister of Health kind of focus fistula and bring it in the forefront in terms of management and care, which we are yet to achieve the set targets.
So would we say that poverty plays a role in fueling delayed intervention, Sharon, from your work so far?
Yeah, I think so, it does. Because you'd find that most of the women who are poor may not be able to access social media, because I'm doing a lot of creating awareness fistula on social media. They may not be able to access my YouTube channel. They will not be able to access even the radio and even the TV when the advertisement about a camp, say in Kenyatta Hospital in Machakos Level 5. And they may not even be able to access their phones, because at times Safaricom sends messages around that there's going to be a camp in a certain place because they're funding, the foundation is funding. So most people, yes, they still live in that cocoon where they think it's normal leaking urine and fecal matter. They've never heard of fistula before because there's no creating awareness. We didn't learn about fistula in our curriculums. No one has done awareness about it.
All right. So, Daktari, even as we think about how best we can help these women, they say prevention is better than cure. What would be an ideal situation to end fistula or obstetric fistula in this country?
First, you must prevent pregnancy. So contraception becomes a big issue that women probably would decide when to have a baby, and not children who are in school. Two, that we must prevent obstructed labor. And when that happens, it has a lot of connotation that in fact it goes back to the community, between the community and the health unit or the facility, and again what happens at the facility to prevent obstructed labor. And the third thing, improve at least the outcome of those women who have obstructed labor. In this way, unfortunately, requires immediate attention, that a woman who has obstructed labor and a diagnosis has been made must then undergo surgery to help her deliver the baby.
And this can only happen if they actually have their babies in a facility.
Yes, because you cannot perform a cesarean operation in the community. So there must be transport, there must be money, and there must be a facility. And at the same time, the facility must be well equipped as to provide an effective and high quality service. And this is what has happened to the wealthy nations, because this emergency that happens after obstetric labor is met with a very fast action. And with that, you prevent fistula from forming.
All right. So, Sharon, you are an ambassador. You have lived this experience and reality, but come out of it a victor. Your words of encouragement to other women.
Yeah, I'd like to encourage other women, especially those women who suspect in that space that they could be having fistula, to come out boldly and just reach out for assistance. At the same time, if you know a colleague or somebody in business who smells urine and fecal matter, don't completely just make a conclusion that they're clumsy and dirty and untidy and all that. Find out if they have that, they could be having fistula, and let them reach out and get help. And again, let us stop the stigma about fistula. Let's stop shunning people. Let's be open about it and be able to talk about it freely so that we can assist women who have fistula.
Very well said. Sharon Korir, who is an obstetric fistula ambassador, thank you for your time. And of course, Dr. Weston Kisa, who is a fistula surgeon, thank you for the information you provided today. And we clearly understand more about this condition that affects a lot of women, and a lot of them do not even know where to start to get the help that they need. For now, let's cross over to the health tip.
When it comes to ab, the most disturbing part of your abs is the lower part, this one. So this one normally is made up of soft fat, and getting rid of soft fat is not easy. So I'm going to show you actually one of the best workout for tackling your lower part of your ab. Okay, it's called leg raises. So there are two options. For those who cannot go for that, they can go for this. Okay? Those who struggle, those who have lower back issues, this is ideal for them. But those who are okay, this is the way. It's up, 1, 2.
Thank you for joining us on this episode, and for any questions or suggestions, you can reach us on our social media handles. My name is Gladys Gachanja, and we have been coming to you from Parking by Radisson here in Westlands. Until next time, see you. It is Health Diary. My name is Gladys Gachanja, and we're coming to you to actually welcome watu. Also, in some cases, literally put aside. I've forgotten that word. Let's go.